Blood-based biomarkers are the real hope for us in primary care because we lack time. We don't see many patients, patient after patient, with cognitive impairment. We know our diagnostic accuracy isn't as secure. Blood-based biomarkers in terms of a context that we as clinicians understand, speaking to your point, Robert, something we're comfortable with, something our patients are very comfortable with, that could be a real game changer. And we do see some research that suggests that accuracy is improved using biomarkers beyond what we'd expect from either a PCP or a specialist diagnostic assessment. Now, that is questionable. If you do a full psychological assessment, then I think your diagnostic accuracy is going to be pretty darn good, especially when you combine it with, as we discussed, an amyloid PET study or a CSF analysis. That's really, I think, the gold standard. But blood biomarkers could certainly move us closer to that. And if nothing else, identify more patients. There's still, though, how to weigh them and make them the most accurate possible, and also just physically how the test is done. We need stronger immunoassays that can make them more broadly available, where we can do thousands of tests at a time across the country. So that's really something to look forward to. And we're right there. I'm not sure we've really crossed that threshold yet.
They work quite nicely in controlled clinical trial situations, but I think they still requires a little bit more real-world evidence to kind of move them into a near future where they will hopefully replace the more invasive and expensive procedures.
I think that it's important with blood-based biomarkers also know both positive predictive value and negative predictive value. Recently in Sweden, it was from community-based patient in Nature Medicine paper at this biomarkers. It was phospho-tau 217 and phospho-tau 181. They have only negative predictive value. Still information that patient can be a little bit more sure they are healthy, will not develop Alzheimer's disease with some probability. Because as for now, all this blood-based biomarker, they are not in clinical use. So we need to have more research on them.
Yes, I totally agree with our discussions. And I would say this is not an issue with blood biomarker themselves, but rather than issues with the degree of understanding of the doctors who use the biomarkers. Because blood biomarkers are more convenient compared to the PET or CSF tests. So they may be performed on populations with lower prior probabilities, resulting in decreasing the accuracy of blood tests. It's very important for us to understand the role and the limitation of biomarkers in the communication, community-based populations, I think.